Heart disease is no longer an old person's illness. Across the Indian subcontinent, a silent epidemic is sweeping through our younger population. The reality is alarming. Half of all acute coronary syndromes in India occur in men under the age of 50. Even more concerning, 25% strike men under 40. According to data from the North India STEMI Registry and the Indian Heart Association, the incidence of coronary artery disease in young Indians is between 12 and 16%, nearly triple the rate seen in Western populations. South Asians are suffering from ischemic heart disease a full decade earlier than the rest of the world. But why is this happening? What makes the young Indian heart so vulnerable? The answer lies in a complex interplay of genetics, metabolism, and modern lifestyle. From a genetic standpoint, South Asians have a higher susceptibility to elevated levels of lipoprotein A, a sticky particle in the blood that promotes atherosclerosis and clotting. Pathologically, the disease process differs too. While plaque rupture is common in Western populations, research indicates that plaque erosion is the predominant pathology for acute coronary syndromes in South Asians. Furthermore, metabolic factors like hypotriglyceridemia, low HDL or good cholesterol, and insulin resistance create a perfect storm for early onset heart disease. While genetics load the gun, lifestyle pulls the trigger. The AMIA study, focusing on very young adults under 30, identified smoking as the most common modifiable risk factor, present in nearly 80% of cases. Physical inactivity affects 3/4 of these young patients. But it's not just diet and exercise. The modern Indian lifestyle brings unprecedented levels of stress. Nearly 30% of young heart attack patients report significant stressful life events prior to their cardiac event. Combined with rising alcohol consumption and a shift towards sedentary urban living, these factors accelerate the atherosclerotic process dramatically.
When a heart attack strikes a young adult, the presentation is often severe. The most common symptom is acute chest pain, reported in 95% of cases. Angiographic studies reveal that the left anterior descending artery, often called the widowmaker, is the culprit in nearly 60% of these young patients. Tragically, young patients often experience delayed presentation. The mean time from symptom onset to reaching the hospital is nearly 17 hours. This delay is deadly. Time is tissue. The longer the heart muscle is deprived of oxygen, the more irreversible the damage. Recognizing the symptoms, chest pain, shortness of breath, profound sweating, and seeking immediate emergency care is absolutely critical. Despite these grim statistics, there is hope. Evidence shows that when young patients do reach the hospital and receive prompt treatment like angioplasty and stenting, their survival rates are actually better than